I'm Dr Rashi Kalra. I'm a fertility specialist at Melbourne IVF. In terms of my background and experience, I completed my obstetric and gynaecology training at the Royal Women's Hospital in Melbourne. After that, I spent extra 3 years qualifying as a CREI, which is a certified reproductive endocrinologist and infertility specialist. Infertility and IVF treatment is my niche area. This is where I focus my expertise, and my passion is to be able to use my knowledge and skills to help patients get pregnant. What initially drew me to fertility medicine was the science of IVF. Being a doctor, I'm definitely a science nerd, and the technology in IVF is incredible. We can achieve pregnancies for couples with incredible success rates that we couldn't have many years ago. What's kept me in the field and kept me passionate about it is seeing the difference we can make in patients' lives. Helping a couple achieve a pregnancy is a life-changing outcome for them, and being incredibly family-orientated myself, to be able to help couples achieve their dream of a family keeps me motivated. I think it's really important for patients going through any kind of fertility treatment or IVF to be well informed and understand their treatment options from day one. I believe patients would report my treatment style as highly informative. I believe it's important to educate patients to empower them to make their own decisions about their treatment, and my job is to guide them to achieve a successful and healthy pregnancy as quickly as possible. Certainly the science of fertility medicine and IVF is fascinating. It's the most rapidly evolving dynamic field in medicine. Newer technologies such as artificial intelligence are very interesting because it may allow us to help patients achieve a healthy pregnancy as quickly as possible. My current area of interest is looking at how we can make IVF services equitable and accessible to people from all walks of life. When you meet a patient or a couple for the first time, your main objective is to help them achieve a successful, healthy pregnancy as quickly as possible. We know that the fertility or IVF journey can be incredibly stressful, and the sooner we can get couples to their goal, the less anxiety is created along the way. My first goal is to take a very detailed history and to ensure any reversible causes, both in the male or female patient, are treated. Ideally, you'd like to try and achieve a pregnancy naturally if possible. And at this stage, it's important to do an extensive workup and investigate the couple. This would involve organising blood tests, potentially ultrasounds, look for reversible causes or things that you can treat to help the couple get pregnant naturally. And if that's not going to achieve a pregnancy for the couple, then it's my job to be fully informative and educate them about their fertility treatment options and to guide them to choose the path that's going to help them achieve a pregnancy as soon as possible. In terms of my hobbies and interests outside of work, I have a young family and they take up all my time outside of work. So I'm predominantly a busy mom, if you can call that a hobby. This is what I probably love the most about fertility and assisted reproductive treatment, or IVF. It is a rapidly changing dynamic field with incredibly fast-paced science. Currently, what interests me or excites me is the role of artificial intelligence in optimizing IVF outcomes for patients. I would advise patients navigating fertility treatment that it is an incredibly difficult road, both physically, emotionally, and sometimes financially. I would tell them that perseverance pays off, and it is worth persisting with treatment to achieve their end goal, which is, of course, a healthy pregnancy.